My name is Denise Coliani, and I am the Internship Coordinator for the Health Promotion and Exercise Sciences Department at Western Connecticut State University. I have been in this position for 17 years. 17 years ago, I had 3 interns per year to place and supervise. I was also teaching a full load of community health courses. This year, I have over 70 interns, and that's my entire job responsibility. Before taking this position, I worked as a public health nurse, home health care administrator, and nursing faculty member in the New York, Connecticut region. Placing and supervising 3 interns was a piece of cake. I had enough contacts from my previous positions to find valuable experiences for my students. This soon became much more challenging, not only because of the increasing number of students, but also because over the ensuing years we've added 3 additional areas of concentration for our students, meaning the placements needed to be more varied. 17 years ago, our students had only one option, a concentration in community health. Today, our students can select an option in community health, wellness management, allied health, or holistic and integrative health. Without formalizing the process, I started reaching out to contacts that I already had to see whether agencies would be willing to take on interns. I got more yeses than nos, and we were off and running. But I saw very quickly that in order to assure that each placement was a quality experience for my students, I needed to put best practices to work in a more formal process. I created an internship handbook for preceptors. This handbook outlines everything from the interview process, contracts, program goals and objectives, independent projects, expectations of the preceptor, to dismissal of students that are not working out. It includes all the paperwork that will be needed to be completed by the preceptors, as well as required assignments by the students. This was not a solo initiative. I had the manual reviewed by seasoned preceptors, as well as other faculty members, and then had it printed by the university so I could distribute it to preceptors. I have distributed the manual to all the preceptors who currently host interns. I have found that having all the policies in one place has improved the quality of the experience for my students. Preceptors tell me that having everything in one place has made it easier for them to find necessary forms and know what is required of each student. When I'm vetting a new internship site, I initiate contact via email, explaining the goals and objectives of our program and attaching a copy of the manual. If the site expresses an interest in participating in our program, I arrange to make a site visit. At that time, I meet with the preceptor, tour the facility, and go over the manual and process in person. If we are both satisfied that this would be a good experience for both the agency and the student, the site is added to my list of potential internship sites. During the first semester that an intern is placed at a site, I make a visit within the first few weeks of placement, follow up with emails and phone calls, and make a second site visit toward the middle of the internship. Developing quality experiences for my students is the primary goal and is a multi-step process. It always starts with a one-to-one connection, but follows with clearly written expectations and in-person visits. My next step is to create the Internship Coordinator Manual so that my role in the university is clearly defined. What started as a part-time faculty responsibility has turned into a full-time faculty line.